right, cool. So just a little banter before we get started, because we were talking about how I am so not techie, and we got Brad Cooper, fellow PT, co-owner of Catalyst Coaching Institute, here with us today. And I'm so excited to be able to host him for one of our masterclass series for all of us who are in healthcare and want to play on the health, wellness, and prevention space. Because, okay, thank you. We got the cue that we are live. And the reason why we're doing this and bringing this to you guys, because more and more people, like lay people, the public, are seeking health coaching for a number of things: to prevent illness, to lose weight, to get fit, to just optimize their health. And so one of the things that always bothered me is, as we spent all this time, all this money, all this energy in our education, and we are the movement specialists, and yet I see people on becoming Instagram famous just because they happen to have created a six-pack for themselves. And then they go around telling everybody what they did, which may or may not be evidence-based and research-based. So because we are the ones that are movement specialists, I think that it is so important for us to be in this space. And I will tell you that going and getting my wellness coach certification and becoming a life coach made me a better therapist. So you want to pay attention, even if you're not considering starting your own business or getting a job as a health coach. You want to tune in and listen to some of the things that we talk about and that Brad shares, so that if you decide that doing the business side of things is not for you, you can use it to augment what you're doing with your patients and create better outcomes. At least that's been my experience.
Well said.
So, thank you. All right. And the other thing that I wanted to share with you all, which I'm going to read directly here, because one of my good buddies and ex-colleagues found this on the APTA website. And it says that physical therapists diagnose and manage movement dysfunction and enhance physical and functional abilities. They restore, maintain, and promote not only optimal physical function, but optimal wellness and fitness, and optimal quality of life as it relates to movement and health. Physical therapists prevent the onset, symptoms, and progression of impairments, physical limitations, and disabilities that may result from diseases, disorders, conditions, or injuries. So that means we're exactly where we're supposed to be. And so if you don't know me, I'm TaVona Denise. I just call myself a physical therapist, life coach, rebel, all these things. And I want to, it's my mission to save as many PTs as I can from burnout, boredom, and glass ceilings. And this is one of the ways. And this handsome young man in front of me is Brad Cooper. As I said before, physical therapist, CEO, and co-founder of Catalyst Coaching Institute. And maybe you can help me with this. I heard that your certification, your health coaching certification, is one of, if not the only recognized sort of health coaching certifications by the APTA. Is that correct?
That's correct. And technically the APTA doesn't accredit them, but the Federation of State Boards of Physical Therapists is the one that covers most states in the country. And we're the only program that's accredited by what's called the FSBPT, or Federation of State Boards of PT. So you're correct.
Awesome. Even better. Great. So co-founder, he's written a number of books, has 2 US patents. Okay. I'm interested to hear about that. Dual master's degrees now. Oh, and you waited till you were 53 to go pursue a PhD. Awesome. Never too late.
That's
Never
right.
too late. And world's fittest CEO. I see you have all of your running and cycling, and the other one behind you is the Iron Man. So world's fittest CEO, which just means to me you walk your talk, right?
Do my best.
So tell me, Brett, how did you and your wife, who I hear is an OT, how did you all get into what you're doing today?
Yeah, it was one of those things, we never planned it. I was a VP of operations for a big healthcare company. They sold our division to another company and gave me a very generous severance package. But part of that package is I could not manage PT clinics for 2 years if I wanted to keep the package. And so I was suddenly, and this was literally almost storybook. It was, I think, 3 days before my 40th birthday, and had no backup plan. I just thought, you get in there, you work hard, things come together, and I'd be doing that the rest of my life. And suddenly it's done. Now, I could have jumped back in, I could have treated patients, but we felt like as a family, let's see what options there are. I was into triathlons at the time and thought, how do we bring triathlon? This sounds hilarious now, but how do we bring triathlon to corporate America? Like, what a dumb comment, right? But we can't sell triathlon to corporate America. But then I realized there's this thing called wellness. And so we developed this company, US Corporate Wellness. We launched it 28 days after I was laid off. We've been very fortunate. It's been a crazy ride, but very fortunate. And in 2011, we launched the Catalyst Coaching Institute that you've emphasized. And that's where people come on a lot of PTs. We have more PTs than any other backgrounds go through our program to earn their certification. So that's the short version. Tried to bring triathlon to the world and ended up bringing wellness to the world. So it's been a good ride.
Awesome. And I love how you took something that you were passionate about and you at least went down that direction to get the feedback like, oh, this is maybe not quite what I need to do. And it allowed you to get to where you are today. And so the takeaway I get from that is like, you just have to go and start and then you'll get the feedback and who knows where it'll take you, but at least be adventurous.
Well, I think that's one of the keys. And it's a lot of what you talk about with your clients. I've got a buddy that's a very good Ironman triathlete, and he told me one of the biggest things to do in a race is keep moving forward. Don't stop. Don't sit on the side of the road. Don't lay down, and keep taking in fuel. So at the aid stations, take something in. So you may not be moving as fast as you'd like. You may not be on pace, but keep fueling and keep moving. And I think in people's careers, if they can remember those two things, keep fueling and keep moving, and know where the finish line, where you're going, that vision piece. If you do those three things, you're going to be successful because so many other people either A, don't ever get on the course, B, don't know where they're heading, or C, they forget to fuel and keep moving. And so they end up 10 miles behind you. So I think that was good advice he intended for triathlon, obviously, but I think it's great life advice too. And you've kind of referenced that as well.
Yeah, 100%. So everybody that's on here right now is curious. There has been, even in the definition of the scope of PT practice, this gray area. So how do you define health coaching? And is there a difference between health and wellness coaching in your mind?
So about 18 months ago, 19 months ago, the wellness coaching world changed pretty dramatically. Prior to that, you and I could be having coffee and I could say, hey, TaVona, do you want to be a wellness coach? And you're like, yeah, that sounds cool. And we could walk out of the coffee shop as wellness coaches. Well, 18 months ago, there came a group called the International Consortium for Health and Wellness Coaches. They've been working on some things behind the scenes. You're obviously familiar with them. And they developed this national board exam that's actually put on by the Board of Medical Examiners. So the same folks that do the physician exam put on the national board certification for wellness coaches. So there's now a completely different area for coaches. How that overlaps with PTs, no one's clear on that. And you and I were kind of bantering back and forth about that before we started. But the concept of, as a PT, I love how you said it builds into your practice. We actually we have a podcast called the Catalyst Health and Wellness Coaching Podcast, and we interviewed two PTs on how are they doing it. They'd both been through the certification. They're both PTs. One of them, just to give you a couple examples, one of them, he's carved about 5 to 10 hours a week out of his weekly schedule. And instead of seeing PT patients, he's doing strictly wellness coaching during that period. The second gentleman has used wellness coaching as almost like the third leg of the stool. So he has a self-pay, cash pay business as a PT. He coaches triathletes and runners and cyclists. And then he does wellness coaching. And what he's found is real interesting is A can lead to B, can lead to C, and back and forth. And he's very clear about what he's doing when he's doing it. So he doesn't come in as a PT and then say, oh, well, I'm kind of a wellness coach. He may be utilizing wellness coaching strategies, but when he's a PT, he's a PT and he's very clear about his role in that situation. So that might be a fun listen for some of the folks that are like, wait a minute, what exactly is this? I think it was last September, October is when that episode ran, but folks can reach out to me. I can find it for them if they can't find it.
And I'll definitely I'll get it from you, or I'll look it up and put it in the comments so that they have access to that.
Okay.
And so here's another question that came to mind. When we talk about documentation and software and things as a PT. We have HIPAA, we have these requirements. So what are these guys doing when it's like, okay, I've got my PT hat on and I'm doing cash PT and I'm under that, versus I've got my wellness coach hat on? What do you
Yes,
say?
so you're not billing insurance for wellness coaching. So that would be one distinguishing piece. We recommend that coaches stay HIPAA compliant on all of their notes, whether they're PT notes or coaching notes. For example, within US Corporate Wellness, we do everything HIPAA compliant. We're one of the URAC accredited firms, so we're very strict on that. But everything is kept in a SOAP note format, and it is HIPAA compliant, it is secure, all those other components. So our suggestion is err on the smart side, the safe side, and make sure you're following those regs regardless.
Okay, and so then that brings me to think about our wonderful PTAs and our CODAs. Are they able to function in the health or wellness coaching space without that supervision of a PT or the evaluation by a PT? As
Yes,
far
good
as you understand.
question. I'm not an attorney, so, and I don't
Yeah.
play on TV either. So my answer is just my opinion out of the gate. But we have a lot of PTs and CODAs that go through our wellness coach certification as well. And they're doing it for one of two reasons. One is to differentiate themselves. So they're out there trying to get jobs, trying to get increased pay, going to the physicians, trying to get people to refer to the PT they're working with. And if they can say to that physician, because think about it, the doc, I mean, this is for PTs or PTAs, the docs get it. They know that the statistics are 98.8% of the population falls short in one of the 5 basic areas of wellness. I mean, think about that. 98.8%. So basically every single one of their patients needs not just the back care, the shoulder care, or whatever it might be. They need help in a lot of different areas. And so if they know that you're a PT who's also a health and wellness coach, even if you're not doing coaching separately, but you're integrating that into the home exercise program, you're integrating that into the discussion, you're integrating that into the subjective piece of the evaluation, that makes you so much more valuable in terms of what you're bringing to the table. And you know how it is, the doc's sitting there looking at 2 options for a PT and who to send to.
Right.
All of a sudden it's an easy choice because TaVona, she's a wellness coach. So I know they're going to get good care for their spine or their knee or whatever, but in the process, TaVona is actually going to take them down the path of thinking through their life and their health and where they're going with things and their sleep and their stress and all these other pieces. So you become the obvious choice all of a sudden.
And so they're not always in their primary care physician or whomever's office talking about ailments that could have been adjusted with lifestyle modifications.
Well, yeah, but you also think about the doctor spending an average of, 4 minutes now with a patient?
Mm-hmm.
The only thing you have time for is a quick diagnosis and a prescription for medications. I just read today that the average 70% of the US population, it's probably over 20, but I'm not sure of that, is taking 1 to 5 medications, and 20% are taking more than 5 medications. Think about that. That's insanity.
That's a lot. And so I work in the acute care setting primarily now, in addition to what I do with coaching. But I find that we get a lot of repeat offenders, because I even had one a couple of weeks ago who could not afford the Eliquis medication that they were on. And it was like, it's $300 a month and I just can't do it.
Totally get that.
And to me, the best investment is prevention, right? So do you want to pay $300 a month, which is a car note for some people, or do you want to pay this health coach and feel amazing?
Right.
So I think for me, the call is to really push this, because I understand what happens on the side when people let it go too far and it goes into illness, like complete illness, not an injury, like I hurt myself or whatever, but when it goes into illness. So and that's one of the reasons why I'm so passionate. I'm so thankful that you and Susanna have created what you have and you have that healthcare spin in that background, so that those of us who are on that side feel a little bit more comfortable in engaging in this, because it's not just if you go to any of these other well coaches or any ICF, any of these other ones, that it's okay. Just like you said, we're in the coffee shop and you said, you want to be a wellness coach, you want to be one, and you walk out, and it's no thought, no consideration, no idea, like, what is HIPAA?
Right.
Exactly.
Exactly.
So that's really why we can. And I'm so thankful that you guys are doing this. But there's one thing that you mentioned that I don't think everybody listening might know, the 5 different areas of wellness. Could you just tell them what that is?
Well, it depends on who you're talking to. So I
Okay.
don't remember the way the AMA defined it for that specific study, but you do look at these wheels of wellness. And by the way, that can be a really powerful tool for people because a lot of folks will come to you thinking that, oh, you're a wellness coach. Oh, that means food and fitness. And yeah, of course, it includes food and fitness, but wellness is holistic. It's well-being, it's life, it's sleep, it's relationships, it's financial fitness, it's all these other things. I'm doing a PhD program right now, as you mentioned, and my focus is on functional mental toughness and what's involved with that. In our first 2 research studies, it was interesting because we found that your functional mental toughness goes up when your foundational well-being is better. How cool is that? So foundational well-being, yeah. So foundational well-being is primarily move, fuel, rest, and connect. And so those would be the core 4 areas. And when you look at the 5 main areas of wellness, you look at the 7 areas of the, kind of health and wellness wheel, they almost all fit into move, fuel, rest, and connect.
100%. And it makes me smile inside because we're getting into riding season. I'm a cyclist. And so I think it hits all of those, right? Yeah. So you move, some of the rides is so tired. I can't do anything but go to sleep for like 3 hours after the ride to rest. And you have to be eating on the bike or you're going to bonk. Or you're going to cramp up. And, and then the connection piece of it, right? So there've been plenty of times where I don't want to do anything. And somebody say, hey, you're going to the ride? Well, I guess I am now.
Remind me, I can send you a link. Our first PhD research study that was published in the International Journal of Sport and Exercise Psychology, it looked at a series of events I'd done on a reflective way and then pulling all the research in of the race across America, which is the race from Oceanside, California to Annapolis, Maryland, which we won. And then preparing for the Ironman, qualifying for Kona Ironman World Championship, and then running a sub 3-hour marathon at age 49, 2 weeks later. And those components that you just mentioned came out dramatically in our study. So remind me, I can send you a link to that. It's pretty interesting how you and we know that inherently, but when we dug into the research, TaVona, it was right there.
Oh, that's incredible.
So
it's just another okay, we have to take care of ourselves and then we can take care of others. And these are some fun outside the box ways that we can do it. Right. So when we look at health coaching, are there some specific skills or tools that we already know or already do as PTs? Why go and get a certification?
One of the funny things about that question, we are incredibly skilled. We're incredibly credible in terms of what we bring to the table. But what we found with physical therapists, and again, we've had so many PTs go through the program that we know this answer very well. What we actually find is the opposite, that you and I as PTs, we're so used to being the expert, and a wellness coach is not the expert. And so I remember I'm trying to think what exactly she said. We had a PT last year, and we do kind of an around the horn, what was your nugget that you got out of the weekend for our fast track training? And she looked at us, she paused, and she said something like, I realized how much you can teach without opening your mouth. And I was just like, wow, Haley Benson, she's awesome. She's a great athlete and a great PT. And when she said that, I was just like, wow, that's good. Because most PTs struggle with the coaching because we're so used to being the expert. They come to us for evaluate and treat, right? They come to us, we're referred to be the expert. And in a wellness coaching role, we got to and draw it out. And so
zipit.com.
when we do the practice coaching sessions, you'll hear the PTs constantly step in with their guidance, their idea, their suggestion. That's not wellness coaching. Every once in a while, there's a place for that. But wellness coaching is drawing out what matters to that person, helping them create the answer that will work for their life, and then helping them build the tools and the resources and the plan to take it further. So it's interesting. PTs are incredibly prepared to do this. And once they finish it, they're probably more credible than most people because of our backgrounds. Mm-hmm. But they got to work hard to break that habit of, oh, wait, that's right. You're the expert as the client. not me.
So when you say, so two things that I got from that, and maybe you can help me remember these. One is this incredible skill that I finally learned the term for, but I learned in coaching, coach training called motivational interviewing. So it sounds a little bit like what you're talking about.
Yep.
And let's start there.
Okay.
Tell us a little bit about motivational interviewing and how we can use it even before we go get coach certification.
You could study it. So we use a lot of motivational interviewing and intrinsic motivation in our coach training. So Susanna, for example, she gets all the credit for our coaching certification. It's really her brain trust. I'm just there to carry her luggage. But the key to that is she went through what's called the MINT training, Motivational Interviewing Network of Trainers. So she's trained to train others in motivational interviewing. And it is a very powerful tool. So the example I was talking about is, this works in wellness coaching, but it also would work just as well in your clinical practice, regardless of your setting. So acute care, cardiopulm, peds, maybe not peds a 3-year-old, but certainly peds a 5-year-old. You approach it differently. So instead of saying, oh my gosh, we left off saying the person told you that it was a 6 out of 10, that was that likely they're going to do their home program. Well, a lot of us as PTs, we're pretty motivated people. So if we're motivated, it's an 8, it's a 9. And so we might look at them and say, a 6? Why is it a 6? Why isn't it an 8? Why isn't it a 9? I thought you were motivated. Well, instead of saying that, because if you say that, then they come back and say, well, because I've got to coach soccer and I'm really busy at work right now and blah, 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 blah. So they actually convince themselves more about why they can't do it instead of less. Instead of reducing that difference between where you'd like them to be and where they want to be. If you flip that, if instead of saying, really, a 6? Are you serious? You say, interesting, a 6. So why is it a 6 and not a 3? Well, now guess what? Now they convince you of all the reasons why it's really important to, well, because, I really want to make this happen. And I think I could do it here and here and here. So that's a simple example that, again, applies certainly to wellness coaching, but it applies so effectively to what we're doing in our clinical practices as well. So that'd be a simple example.
Awesome. Thank you so much for repeating that.
Absolutely.
And one of the things that I heard you say was if you go and you get your health or wellness coach certification, the PTs have a lot more credibility in that regard. One of the questions that I'm asked all the time is how to stand out in the sea of health coaches. And one thing that you mentioned was the credibility as a PT, but I often find that that's not quite enough. Has that been your experience in terms of marketing oneself effectively as a coach, a health coach?
Yeah. So if we come back to the word differentiation, and I know you go through this with your clients, so I'm preaching your message here, but differentiation is by definition different. It just means you're different. So that it doesn't stop at PT. It doesn't stop at wellness coach. It's your life. It's your reputation. It's your experience. It's like when we first started our company, one of our first clients came to us because I was a triathlete. I'd been to the Hawaii Ironman 4 times. Someone saw a flyer we'd done. They're like, oh, I think I know that guy. They called me up. We got to talking. Now, once we got to talking, our company had to prove it. But I wouldn't have gotten the conversation without the triathlon piece. So our differentiation as PTs and or as wellness coaches, it's your life, folks. You are the message. Are you providing the message that you want? And do you have the credibility to be that message? And the wellness coaching helps expand that out a little bit more.
100%. So what would be the easiest or best way for someone to get started if they're interested in getting the coaching certification?
Yeah, you've got a couple options. So the Federation of State Boards of Physical Therapists accredits both of our programs. Distance learning, you can do anytime from your home, the whole, soup to nuts, you're done. You never leave your home. The fast track, if you can swing it, I'd strongly encourage that because that gives you a weekend with a bunch of other fired up people that are really into this. You get the lunchtime conversations. We actually talk about the business side of wellness coaching during the 2 lunch hours for people that want to. So if you can swing it, that's the way to go. We do those 4 times a year in Colorado. We just had one. Our next one is June 1st and 2nd. And then we've got one late August as well. And your timing is great, TaVona, because we just confirmed a New Jersey course that'll be August
East Coast.
16th and 17th. Yeah. Yeah. So that one, that'll be our first, let me double check the date. That'll be our first East Coast fast track weekend. It'll be, Friday and Saturday, August 16th and 17th. The Colorado one is the following weekend, August 24th and 25th. And again, there's the June 1st and 2nd. So the New Jersey one is already half full because the host group is totally into it, and they filled half the spots out of the gate. So if you're interested in that New Jersey one, don't wait too long because that one will fill right away. So those are your two options. You do the fast track, and then in addition to that weekend, there's a bunch of stuff you can do from home. The key differentiator besides the one-on-one time is the ICHWC, so that National Board Certification. If that's something the PT is wanting to eventually do, they require the face-to-face time. So if that's the route you're wanting to go, pick New Jersey or pick Denver. The one caveat to that is you can change your mind. The way we've set up our program, because we have a lot of people that start distance learning and they're like, I think I do want to do that board thing. We don't charge you again. So as long as our price hasn't changed, you can come for free to the fast track if you've been doing the distance learning. You just have to let us know in enough advance warning that we can save you a spot. So that's one option.
Very awesome.
Yeah.
So since you're in Colorado and CSM is in Colorado in January 2020, will you be having one around there for people to kind of like extend their stay or come early or kind of work that out?
Well, we weren't until you just said that, but I'm going to write that down. CSM.
I mean, help people out.
All right. And I know you'll be there, so that'll be good.
Yeah, I'm looking forward to skiing.
Yeah, I bet. You should get pretty good snow in January.
Yeah. So people know they have choices in August in New Jersey, but don't wait too long. You have also in August in Colorado and possibly now around CSM.
Right.
And so how can they connect with you if they want to follow your school and get more information and be the first to know about all the wonderfulness happening?
Yeah, the best spot would be the website catalystcoachinginstitute.com. And we actually host our podcast on that site too. And we have got the cat's meow coming up. We have our best back-to-back interviewees. I can't tell you who they are, but it's going to be awesome. We just interviewed four-time Ironman world champion Chrissy Wellington about how coaching is really important, not sports coaching, but the stuff that you and I are talking about. We have Brad Stolberg, the author of Passion Paradox and Peak Performance. He's next Monday, so I guess I gave that one away. We have Dr. Carla Mayen talking about. You heard it here first. That's right. Hey, right here, cutting edge, breaking news.
That's too funny.
That's cool. If you're into the coaching thing, check that one out. They're all you'll love them. They're really cool guests, really gracious guests. So the catalystcoachinginstitute.com. And if you're into the human performance stuff, that's what I use Twitter for. So I don't post much on Twitter. I actually just posted a note that I'm going to be joining you tonight. But the main purpose for Twitter on my end is human performance. So research studies, new insights. So if you're into that kind of stuff, that's an easy spot to find me. It's at Catalyst, the number 2, Thrive. So Catalyst 2 Thrive, with the 2 being the number 2.
And I'll post that in the comments somewhere. So if you guys are watching this later, you can look at it, okay? And copy it, and click it, and all that wonderful stuff. What's up?
One other thing I didn't want to forget, because it's so cool. You're going to love this. Okay. We are doing the first ever health and wellness coaching retreat in Colorado this September. It is going to be off the hook. So awesome. Because think about it. Every time you go to I don't know if you feel like this, but every time I go to a conference, I'm exhausted. Like I'm overwhelmed, exhausted. I come back more tired than I left, and it's super expensive. So we're going to do a retreat. What's the date of it? September 6th through the 8th in Estes Park, Colorado. I love a good retreat. It's beautiful, and it's not that expensive either. We're doing it at the YMCA camp. So the housing, it's less than you've ever paid in your life for a conference. So, and early registration for the retreat is pretty cheap if you do it before the end of May. So yeah, it's going to be cool.
You got time, people.
You got plenty of time. Okay.
Awesome. Well, I want to thank you so much for not only your time this evening, but for everything that you all are doing for the world, for the profession. And I look forward to staying in touch. And hopefully, plenty of the people that are watching today will go and get the certification, because I 100% attribute my low refusal rates, the amazing results that I get for my patients, from the skills that I learned by becoming a coach. Am I the best therapist ever? I think I'm pretty awesome. But I think I'm amazing because of my coaching ability and really getting the patient to believe in themselves. It's not me telling them, it's their own intuition and their own belief. And I transfer belief to them. And then they do these things and they're like, I couldn't even believe I did that. So even if you're not looking at this in terms of a business, but you want to take your practice and your abilities and all of this to the next level, I highly encourage you to consider investing in getting coach training. So that's my 2 cents. I have nothing to do with the actual coach training itself. I just help you build a business if that's what you want to do. But I believe in it that much. And so thank you so much for being here, Brad. And
That
we'll
was an
talk
honor.
soon.
Thank you so much. It's great to see you again.
All right, thanks. Bye.
Take care.